Did you know that some people continue to experience health problems long after having COVID-19? Most people who get coronavirus disease recover within a few weeks, but some people even might have symptoms that last a long time afterward. These ongoing health problems are sometimes called post-COVID-19 syndrome, long COVID-19, or long-haul COVID-19. Less people are known about the post-COVID-19 long side effects. There is very limited evidence about the management of COVID-19 after the first 3 weeks of illness. They suggest that about 10% of people experience prolonged illness after being affected by COVID-19. Maybe some of you that are watching this video are experiencing post-COVID-19 syndrome without even knowing it. Well, stick to the end of the video to discover how people affected by COVID-19 can develop some side effects or health issues afterwards, so you can understand the possible symptoms and risk factors of the post-COVID-19 syndrome. First of all, what is the post-COVID-19 syndrome? Post-COVID-19 syndrome involves a variety of new, returning, or ongoing symptoms that people experience more than 4 weeks after getting COVID-19. In some people, post-COVID-19 syndrome lasts months or years or causes disability. These persons can have fatigue, shortness of breath, brain fog, and other symptoms long after the time of their infection. Some research shows that some of the cells that are used to create immunity after an infection may be malfunctioning in this condition in people with long-haul COVID. Research suggests that between 1 month and 1 year after having COVID-19, 1 in 5 people ages 18 to 64 has at least one medical condition that might be due to COVID-19. Among people aged 65 and older, 1 in 4 has at least one medical condition that might be due to COVID-19. A recent study on post-COVID-19 symptoms found that more women than men suffer long-term effects. Women predominantly showed symptoms of fatigue, followed by muscle pain and low blood pressure, while men primarily experienced shortness of breath. Research is also underway to better understand what may be causing post-COVID-19 syndrome. The most commonly reported symptoms of post-COVID-19 syndrome include fatigue, symptoms that get worse after physical or mental effort, fever, lung or respiratory symptoms, including difficulty of breathing or shortness of breath and cough, attention deficit, cognitive problems that lower the faculty of thinking and memory, hair loss, dyspnea, myalgia, and arthralgia. People may experience other symptoms related to COVID-19 syndrome, and they are as followed: neurological symptoms or mental health conditions. This include difficulty thinking or concentrating, headache, sleep problems, dizziness when you stand, pins and needles feeling, loss of smell or taste, and depression or anxiety. Heart symptoms or conditions that include chest pain and fast or pounding heartbeat, rash and changes in the menstrual cycle, joint or muscle pain, digestive symptoms such as diarrhea and stomach pain, blood clots and blood vessel issues, including a blood clot that travels to the lungs from deep veins in the legs and blocks blood flow to the lungs, which is called pulmonary embolism. Keep in mind that that doesn't mean you are having it. It can be hard to tell if you are having symptoms due to COVID-19 or another cause, such as a pre-existing medical condition. So, that doesn't mean any syndrome you have after being affected by COVID-19 should be a side effect related to this virus. It would be better to see a care provider to determine what's exactly going on with you. It's also not clear if post-COVID-19 syndrome is new and unique to COVID-19. Some symptoms are similar to those caused by chronic fatigue syndrome and other chronic illnesses that develop after infections. Chronic fatigue syndrome involves extreme fatigue that worsens with physical or mental activity but doesn't improve with rest. What can explain COVID-19 to cause an ongoing health problem to people? One of the reasons that can explain this health problem is the damage of organs. People who had severe illness with COVID-19 might experience organ damage affecting the heart, kidneys, skin, and brain. Inflammation and problems with the immune system can also happen. It isn't clear how long these effects might last. The effects also could lead to the development of new conditions, such as diabetes or a heart or nervous system condition. The experience of having severe COVID-19 might be another factor. This can result in extreme weakness and post-traumatic stress disorder, a mental health condition triggered by a terrifying event. While it's obvious that people with certain risk factors, including high blood pressure, smoking, diabetes, obesity, and other conditions are more likely to have a serious bout of COVID-19, there isn't a clear link between these risk factors and long-term problems. In fact, long COVID syndrome can happen in people who had mild symptoms, although others with more severe initial illness seem to be more likely to have long-term side effects. Overall, you might be more likely to have post-COVID-19 syndrome if you had severe illness with COVID-19, especially if you were hospitalized or needed intensive care. You had certain medical conditions before getting the COVID-19 virus. You had a condition affecting your organs and tissues while sick with COVID-19 or afterward. Post-COVID-19 syndrome also appears to be more common in adults than in children and teens, as well as in people who had a health problem before contracting COVID-19. However, anyone who gets COVID-19 can have long-term effects, including people with no symptoms or mild illness with COVID-19. So, more studies need to be made to shed light on why these stubborn health problems persist in some people affected by COVID-19. I hope you found value in this video. Don't forget to subscribe to the channel, hit the like button and the notification bell so that you never miss out on any new informative video uploaded. Remember, your health is your priority. I'll see you in the next informative episode.